Question 1. Compliance review shows that a patient has been prescribed clopidogrel 75 mg daily. The patient's electronic health record includes a pharmacogenomic report indicating a CYP2C19 poor metabolizer genotype. The pharmacist is preparing to dispense the clopidogrel. Which of the following actions is most appropriate for the pharmacist to take in this situation? Option A. Inform the patient about the CYP2C19 poor metabolizer genotype and advise them to discuss it with their doctor at their next appointment. Option B. Dispense the clopidogrel and document the pharmacogenomic finding in the patient's profile without further action. Option C. Dispense the clopidogrel as prescribed and counsel the patient on general medication adherence. Option D. Contact the prescriber to discuss the CYP2C19 poor metabolizer genotype and its implications for clopidogrel therapy, recommending consideration of an alternative antiplatelet agent. Correct answer is C. Dispense the clopidogrel as prescribed and counsel the patient on general medication adherence. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of pharmacogenomic information in optimizing patient care and preventing adverse drug reactions. A pharmacist's failure to recognize and act upon such information can lead to suboptimal treatment, increased risk of side effects, and potential harm to the patient. The challenge lies in integrating complex genetic data into routine clinical decision-making and communicating its implications effectively to both the prescriber and the patient, all while adhering to privacy regulations. Correct approach analysis. The correct approach involves recognizing the significance of the pharmacogenomic test result for the prescribed medication. Specifically, if a patient has a genetic variant that significantly impacts the metabolism or efficacy of a drug e.g., CYP2C19 polymorphism affecting clopidogrel metabolism, the pharmacist has a professional and ethical responsibility to address this. This approach aligns with the principles of individualized drug therapy, a core tenet of modern pharmacy practice, and is supported by guidelines emphasizing the use of pharmacogenomic data to improve patient outcomes and safety. Pharmacist's role extends beyond dispensing to ensuring the appropriateness of the therapy based on the patient's unique genetic profile, thereby preventing potential adverse drug reactions or treatment failure. This proactive intervention is crucial for patient safety and effective pharmacotherapy. Incorrect approaches analysis. Dispensing the medication without considering the pharmacogenomic information represents a failure to provide comprehensive pharmaceutical care. This approach ignores the potential for altered drug response or increased risk of adverse events, directly contradicting the principles of individualized therapy and patient safety. It also fails to leverage available clinical data to optimize treatment, potentially leading to ineffective therapy or harm. Contacting the prescriber solely to confirm the prescription without mentioning the pharmacogenomic finding is an incomplete intervention. While communication with the prescriber is essential, failing to highlight the critical pharmacogenomic data means the prescriber may not be aware of the potential implications, thus perpetuating the risk of suboptimal therapy. This approach misses a key opportunity to collaborate on optimizing the patient's treatment plan. Educating the patient about the pharmacogenomic test results in isolation, without discussing its direct implications for the current prescription, is insufficient. While patient education is important, the immediate clinical relevance of the pharmacogenomic finding to the prescribed medication needs to be addressed directly to ensure safe and effective drug use. This approach delays or omits the critical step of modifying or confirming the therapy based on the genetic information. Professional reasoning. Pharmacists should employ a systematic decision-making framework when presented with pharmacogenomic data. This framework includes 1. Identifying the relevant pharmacogenomic information and its known clinical implications for the specific drug prescribed. 2. Assessing the patient's current medication regimen and clinical status in light of this information. 3. Collaborating with the prescriber to discuss potential therapeutic adjustments, such as dose modification, alternative drug selection, or continued monitoring. 4. Educating the patient about the rationale for any changes and the importance of their genetic profile in their treatment. 5. Documenting all interventions and communications. This approach ensures that pharmacogenomic data is actively used to personalize and optimize patient care, adhering to professional standards and regulatory expectations for patient safety. Question 2. Investigation of a patient's lack of therapeutic response to a compounded sterile injectable medication prompts a pharmacist to review the compounding process. The patient has been receiving the medication for 3 days with no improvement in their condition, which is contrary to previous successful treatments with the same formulation. The pharmacist suspects a potential issue with the compounded preparation itself. Which of the following is the most appropriate initial course of action for the pharmacist to take? Option A. Advise the patient to continue the medication as prescribed and consult with the prescriber to explore alternative treatment options due to potential disease progression. Option B. Discard the remaining portion of the compounded medication and instruct the patient to obtain a new prescription from the prescriber. Option C. Immediately recompound the medication using the same formulation and ingredients, ensuring meticulous attention to detail. Option D. Conduct a thorough investigation of the compounding process, including a review of the compounding log, ingredient verification, equipment calibration, and environmental monitoring records for the affected batch. The correct answer is C. Immediately recompound the medication using the same formulation and ingredients, ensuring meticulous attention to detail. Explanation. This scenario presents a professional challenge due to the potential for patient harm arising from a compounding error that impacts drug efficacy and safety. The pharmacist must exercise careful judgment to identify the root cause of the observed patient response and implement corrective actions that align with regulatory standards for sterile compounding and quality assurance. The correct approach involves a thorough investigation of the compounding process, including a review of the compounding log, ingredient verification, equipment calibration, and environmental monitoring. This systematic approach is mandated by USB 797 Pharmaceutical Compounding Sterile Preparations, which requires adherence to established procedures to ensure the sterility, quality, and purity of compounded sterile preparations. By meticulously examining each step, the pharmacist can identify deviations from established protocols, such as incorrect ingredient measurement, improper mixing technique, or contamination, which could lead to an under- or overpotent preparation. This aligns with the pharmacist's ethical responsibility to safeguard patient health and the legal requirement to practice pharmacy in accordance with established standards. An incorrect approach would be to assume the patient's non-response is solely due to disease progression or non-adherence, without investigating the compounded medication. This fails to acknowledge the pharmacist's direct responsibility for the quality of the compounded product and violates USB 797 by not performing a root cause analysis of a potential compounding error. Another incorrect approach would be to immediately recompound the medication without identifying the specific error in the previous batch. This bypasses the critical quality assurance step of understanding what went wrong, potentially leading to repeated errors and continued risk to patients. Furthermore, failing to document the investigation and corrective actions would be a significant regulatory failure, as USB 797 and general pharmacy practice standards require thorough documentation of all compounding activities and any deviations or investigations. The professional reasoning process for similar situations should involve a systematic, evidence-based approach. When a patient experiences an unexpected outcome with a compounded medication, the pharmacist must first consider the compounded product as a potential source of the issue. This triggers a mandatory investigation, guided by relevant USB chapters and State Board of Pharmacy regulations. The investigation should be comprehensive, examining all aspects of the compounding process and product quality. Documentation is paramount throughout this process. If an error is identified, immediate steps must be taken to prevent further harm, which may include recalling affected batches, notifying patients and prescribers, and implementing corrective and preventative actions. Question 3. The performance metrics show an increase in prescription dispensing errors related to incorrect medication strength being dispensed. A recent incident involved a prescription for a high-alert medication where the dispense strength differed from the prescribed strength, though the error was caught by the patient before administration. Pharmacist on duty identified the discrepancy by comparing the dispensed product to the original prescription during a routine quality assurance check. What is the most appropriate immediate course of action for the pharmacist? Option A. Immediately contact the prescriber to clarify the intended dosage and inform them of the dispensing error, then counsel the patient on the correct medication and dosage before dispensing the corrected prescription. Option B. Counsel the patient on the importance of verifying their medications and inform them that the pharmacy will review its dispensing process to prevent future errors. Option C. Dispense the corrected medication to the patient immediately, assuming the patient will understand the change, and address the performance metric trend later. Option D. Document the error in the pharmacy's incident reporting system and proceed to dispense the corrected medication to the patient without further investigation or prescriber contact. The correct answer is A. Immediately contact the prescriber to clarify the intended dosage and inform them of the dispensing error. Then counsel the patient on the correct medication and dosage before dispensing the corrected prescription. Explanation. This scenario presents a professional challenge due to the potential for medication errors and patient harm stemming from a breakdown in communication and adherence to established dispensing procedures. A pharmacist must balance efficiency with the absolute necessity of ensuring medication accuracy and patient safety, all while operating within federal and state pharmacy laws and regulations. Careful judgment is required to identify the root cause of the discrepancy and implement corrective actions that prevent recurrence. The correct approach involves a thorough investigation of the dispensing error, including a review of the original prescription, the dispensed medication, and the pharmacy's internal workflow. This approach prioritizes patient safety by ensuring the correct medication and dosage are dispensed. It aligns with federal and state regulations that mandate accurate dispensing and pharmacist responsibility for verifying prescription accuracy. Furthermore, it upholds ethical obligations to protect patient well-being and maintain public trust in the pharmacy profession. This systematic review is crucial for identifying systemic issues that may have contributed to the error, such as inadequate technician training, insufficient workflow checks, or issues with the pharmacy's information system. An incorrect approach that involves immediately dispensing the medication without further verification fails to uphold the pharmacist's primary responsibility for patient safety and accurate dispensing. This bypasses critical quality assurance steps and directly violates regulations requiring prescription accuracy. Another incorrect approach, which is to simply document the discrepancy without investigating its cause or implementing corrective actions, neglects the proactive risk management required in pharmacy practice. This passive approach allows potential systemic flaws to persist, increasing the likelihood of future errors and potentially violating quality assurance mandates. Finally, an approach that focuses solely on blaming the technician without a comprehensive review of the workflow and potential contributing factors is unprofessional and fails to address the underlying issues that led to the error, thus not preventing future occurrences. Professionals should employ a decision-making framework that begins with identifying the immediate risk to the patient. This is followed by a systematic investigation of the error, referencing relevant pharmacy laws, regulations, and best practice guidelines. The process should involve a root cause analysis to understand why the error occurred and the development of a corrective action plan to prevent similar errors in the future. This includes evaluating and potentially revising dispensing procedures, enhancing training, or improving communication protocols. Question 4. The control framework reveals a situation where a pharmacy technician, during a busy period, dispensed a medication with a similar-sounding name to the one prescribed for a patient. The patient, upon receiving the medication and reviewing their home medication list with the pharmacist, expresses confusion about the new medication's appearance and purpose. The pharmacist recognizes this as a potential medication error involving a look-alike/sound-alike (LASA) medication. Which of the following represents the most appropriate and comprehensive course of action for the pharmacist to ensure patient safety and comply with regulatory expectations? Option A. Advise the patient to return the medication and obtain the correct one from their physician's office without further investigation or reporting by the pharmacy. Option B. Focus on reprimanding the technician for the error and implement stricter supervision without initiating a formal reporting process or root cause analysis. Option C. Counsel the patient on the medication they received, advising them to consult their physician if they have further concerns, and assume the technician followed proper procedures. Option D. Immediately retrieve the dispensed medication, verify the correct medication, counsel the patient on the correct medication and its safe use, document the incident internally for quality improvement, and report the potential adverse drug event to the appropriate regulatory body. The correct answer is D. Immediately retrieve the dispensed medication, verify the correct medication, counsel the patient on the correct medication and its safe use, document the incident internally for quality improvement, and report the potential adverse drug event to the appropriate regulatory body. Explanation. This scenario is professionally challenging because it involves a critical patient safety issue stemming from a potential medication error, specifically involving a high-alert medication. The pharmacist must navigate the immediate need to ensure patient safety, while also adhering to regulatory requirements for error reporting and quality improvement. The complexity arises from balancing immediate patient care with the systematic investigation and prevention of future errors, all within the strict confines of NAPLEX relevant regulations. The correct approach involves a multifaceted strategy that prioritizes patient safety and adheres to the principles of medication error management and adverse drug event reporting as mandated by U.S. federal and state pharmacy laws and professional guidelines. This includes immediate intervention to mitigate harm, thorough documentation, reporting to relevant authorities, e.g., FDA MedWatch, internal quality improvement programs, and a comprehensive medication reconciliation process to identify and address discrepancies. The pharmacist's role in patient counseling regarding medication safety is also paramount. This approach aligns with the U.S. Pharmacopoeia USP, General Chapter 1066 Pharmaceutical Quality, Patient Safety, which emphasizes the importance of error prevention systems, root cause analysis, and continuous quality improvement. It also reflects the principles of the Joint Commission's National Patient Safety Goals, which aim to improve the safety of using medications. An incorrect approach would be to dismiss the event as a minor oversight without further investigation or reporting. This fails to meet the regulatory obligation to report adverse drug events and medication errors that could lead to patient harm. It also neglects the opportunity for root cause analysis, which is essential for identifying systemic issues and implementing preventative measures, thereby violating principles of quality improvement and patient safety. Another incorrect approach would be to focus solely on disciplinary action against the staff member involved without a systematic investigation into the underlying causes of the error. This reactive approach does not address the systemic factors that may have contributed to the error, such as inadequate training, flawed workflow, or insufficient resources, and therefore does not contribute to long-term patient safety improvements. It also fails to comply with the spirit of error prevention systems that aim to learn from mistakes rather than solely punish individuals. A third incorrect approach would be to only counsel the patient on the immediate medication without addressing the potential for similar errors in the future or initiating a review of the dispensing process. While patient counseling is vital, it is insufficient on its own to prevent recurrence. A comprehensive approach requires an examination of the entire medication use process, from prescribing to administration, to identify and rectify vulnerabilities. This overlooks the importance of error prevention systems and quality improvement initiatives that are central to patient safety. The professional decision-making process for similar situations should involve a structured approach. 1. Assess immediate patient risk and intervene to mitigate harm. 2. Document the event thoroughly. 3. Report the event according to institutional policy and regulatory requirements e.g., FDA MedWatch, state boards of pharmacy. 4. Initiate a root cause analysis to understand contributing factors. 5. Implement corrective and preventative actions. 6. Review and update policies and procedures. 7. Reinforce patient counseling on medication safety. This systematic process ensures that patient safety is paramount while also fostering a culture of continuous improvement and accountability. Question 5. The review process indicates that a recent observational study published in a peer-reviewed journal suggests a novel therapeutic agent for hypertension demonstrates a statistically significant reduction in systolic blood pressure compared to placebo, with a reported p-value of 0.03. The confidence interval for the mean difference in systolic blood pressure was wide and included clinically insignificant values. The study involved a retrospective chart review of patients who received the agent versus those who received placebo, with no blinding of outcome assessors. A randomized controlled trial, RCT, investigating the same agent in a similar patient population, published 2 years prior, showed a trend towards reduced systolic blood pressure, but did not reach statistical significance, p-value equals 0.15, and had a narrow confidence interval, indicating a small, clinically insignificant effect. Which of the following represents the most appropriate interpretation and application of this information for a pharmacist considering this agent for a patient? Option A. Advocate for the use of the agent in the observational study's patient population, as retrospective data is often more reflective of real-world practice. Option B. Prioritize the findings of the randomized controlled trial due to its superior study design for establishing causality, and conclude that the agent is unlikely to be clinically effective. Option C. Acknowledge the conflicting results and recommend further investigation through a well-designed, prospective, randomized, placebo-controlled trial to definitively assess the agent's efficacy and safety. Option D. Recommend the novel therapeutic agent based on the statistically significant finding in the observational study, as it suggests a potential benefit. The correct answer is D. Recommend the novel therapeutic agent based on the statistically significant finding in the observational study, as it suggests a potential benefit. Explanation. This scenario is professionally challenging because it requires a pharmacist to critically evaluate research findings and apply them to patient care, balancing the potential benefits of a new treatment with the limitations of the study design and statistical interpretation. The pharmacist must move beyond simply accepting published results and instead engage in a rigorous assessment of the evidence's validity and applicability. Careful judgment is required to avoid premature adoption of potentially ineffective or unsafe treatments, or conversely, to avoid withholding beneficial therapies due to an overly cautious or misinformed interpretation of the data. The correct approach involves a thorough understanding of research methodology, specifically recognizing the strengths and limitations of different study designs. In this case, acknowledging that a randomized controlled trial, RCT, provides a higher level of evidence than an observational study is crucial. The pharmacist must then critically assess the reported statistical significance, p-value, and the precision of the effect estimate, confidence interval, in the context of the study's design and the clinical relevance of the findings. This approach aligns with the principles of evidence-based medicine, which mandates the integration of the best available research evidence with clinical expertise and patient values. Regulatory frameworks and professional guidelines emphasize the pharmacist's role in ensuring patient safety and optimizing therapeutic outcomes through informed decision-making based on sound scientific principles. An incorrect approach would be to solely rely on the p-value without considering the confidence interval or the study design. A statistically significant p-value e.g. 0.005 indicates that the observed result is unlikely to be due to chance, but it does not quantify the magnitude or certainty of the effect. Without the confidence interval, the pharmacist cannot gauge the precision of the estimate. A narrow confidence interval suggests a more precise estimate, while a wide one indicates considerable uncertainty. Furthermore, prioritizing an observational study over an RCT, despite the latter's superior ability to establish causality due to randomization and blinding, would be a significant methodological error. Observational studies are prone to confounding variables and bias, making it difficult to definitively attribute observed associations to the intervention. Another incorrect approach would be to dismiss the findings entirely due to minor protocol deviations, without a comprehensive assessment of their potential impact on the validity of the results. While protocol adherence is important, minor deviations may not always invalidate the study's conclusions, especially if the overall integrity of the randomization and blinding was maintained. The professional reasoning process should involve a systematic evaluation of research. First, assessing the study design's hierarchy of evidence. Second, examining the statistical measures of significance and precision. Third, considering the clinical relevance and applicability of the findings to the specific patient population. And finally, integrating this evidence with clinical expertise and patient-specific factors. Question 6. Process analysis reveals a 68-year-old male patient with a history of heart failure with reduced ejection fraction, HFrF. Hypertension and hyperlipidemia is being managed by his primary care physician. His current medication regimen includes lisinopril, furosemide, metoprolol succinate, and atorvastatin. The patient reports feeling a little more tired than usual, but denies significant shortness of breath or edema. Recent laboratory results show a stable serum creatinine and potassium. The pharmacist is reviewing the patient's profile during a routine refill. Which of the following approaches represents the most appropriate professional action for the pharmacist in this situation? Option A. Advise the patient to increase his furosemide dose if he experiences increased fatigue, as this may indicate fluid retention. Option B. Contact the prescriber to request a change in the patient's metoprolol succinate to a beta blocker with a shorter half-life for potentially faster symptom relief. Option C. Counsel the patient on the importance of rest and avoiding strenuous activity due to his age and history of heart failure. Option D. Recommend to the prescriber the addition of an angiotensin receptor neprilysin inhibitor ARNI to the patient's regimen in accordance with current guideline-directed medical therapy for HFrEF and provide patient education on the new medication and potential benefits. Correct answer is D. Recommend to the prescriber the addition of an angiotensin receptor neprilysin inhibitor ARNI to the patient's regimen in accordance with current guideline-directed medical therapy for HFrEF and provide patient education on the new medication and potential benefits. Explanation. This scenario presents a professional challenge due to the critical nature of managing a patient with a complex cardiovascular condition, specifically heart failure with reduced ejection fraction, HFrEF, and the need to integrate new therapeutic guidelines into practice. The pharmacist must navigate potential drug interactions, patient-specific factors, and evidence-based treatment recommendations to ensure optimal patient outcomes while adhering to professional standards and regulatory requirements for patient care and medication management. The correct approach involves a comprehensive medication therapy management, MTM, assessment. This includes reviewing the patient's current medication regimen for efficacy, safety, and adherence, identifying any potential drug interactions or contraindications, and evaluating the patient's understanding of their condition and treatment plan. The pharmacist should then collaborate with the prescriber to recommend evidence-based adjustments to the patient's therapy, prioritizing guideline-directed medical therapy, GDMT, for HFrEF, which now includes the addition of an ARNI, angiotensin receptor neprilysin inhibitor, if not already present and appropriate. This approach aligns with the pharmacist's role in patient care, promoting medication safety, and ensuring adherence to current best practices as outlined by professional organizations and regulatory bodies governing pharmacy practice in the United States. The pharmacist's responsibility extends to patient education on new medications and lifestyle modifications, which is a cornerstone of effective chronic disease management. An incorrect approach would be to simply continue the existing prescription without further assessment. This fails to address the potential for improved patient outcomes through updated GDMT and neglects the pharmacist's professional responsibility to proactively manage patient therapy and identify opportunities for optimization. It also overlooks the potential for adverse events or suboptimal treatment if the patient's condition has evolved or if newer, more effective therapies are available. Another incorrect approach would be to unilaterally change the patient's medication regimen without consulting the prescriber. This violates the collaborative practice model and the scope of practice for pharmacists, potentially leading to medication errors, patient harm, and regulatory noncompliance. Pharmacists are expected to make recommendations and collaborate with prescribers, not to independently alter prescribed therapies outside of established collaborative practice agreements or emergency protocols. A third incorrect approach would be to focus solely on the patient's reported symptoms without a thorough medication review and consideration of GDMT. While symptom management is important, it is insufficient for addressing the underlying pathophysiology of HFrEF. A comprehensive assessment must encompass all aspects of the patient's pharmacotherapy and disease management, including adherence to evidence-based guidelines. The professional reasoning process for similar situations should involve a systematic approach. First, assess the patient's current clinical status and medication regimen. Second, identify any deviations from evidence-based guidelines or potential therapeutic issues. Third, consult relevant clinical practice guidelines and drug information resources. Fourth, communicate findings and recommendations collaboratively with the prescriber. And fifth, educate the patient on their treatment plan and monitor for efficacy and safety. This structured approach ensures that patient care is evidence-based, safe, and effective, upholding the pharmacist's professional obligations. Question 7. Assessment of a 68-year-old male patient with a history of hypertension, hyperlipidemia, and type 2 diabetes mellitus reveals he is taking lisinopril, atorvastatin, metformin, and aspirin. He reports developing a new, persistent dry cough over the past 2 weeks, which began shortly after a recent medication adjustment. The pharmacist suspects this cough may be an adverse drug reaction. Which of the following is the most appropriate initial approach for the pharmacist to take? Option A. Immediately discontinue all of the patient's current medications to rule out any potential adverse effects. Option B. Recommend discontinuing the lisinopril and advise the patient to monitor for symptom resolution, then communicate this recommendation to the prescriber. Option C. Advise the patient to take an over-the-counter cough suppressant to manage the symptom while continuing all current medications. Option D. Inform the patient that dry cough is a common symptom of his diabetes and not likely related to his medications. The correct answer is B. Recommend discontinuing the lisinopril and advise the patient to monitor for symptom resolution, then communicate this recommendation to the prescriber. Explanation. Scenario analysis. This scenario presents a common challenge in pharmacy practice, managing a patient with a complex medication regimen experiencing a potential adverse drug reaction, ADR. Professional challenge lies in accurately identifying the causative agent among multiple medications, understanding the underlying pharmacological principles of the ADR, and implementing appropriate management strategies while adhering to patient safety and regulatory guidelines. The pharmacist must balance the need to alleviate the patient's symptoms with the risk of exacerbating their condition or causing further harm by discontinuing necessary medications. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's medication list, considering the known pharmacokinetic and pharmacodynamic profiles of each drug, and correlating them with the onset and characteristics of the observed adverse event. This includes reviewing the patient's medical history for predisposing factors and consulting reliable drug information resources to identify potential drug-drug interactions or drug-disease interactions. The pharmacist must then communicate their findings and recommendations to the prescriber, prioritizing patient safety by suggesting a course of action that minimizes risk, such as discontinuing the most likely offending agent or initiating a therapeutic alternative. This aligns with the pharmacist's role as a medication expert, mandated by state pharmacy practice acts and professional standards to ensure safe and effective drug therapy, and to report ADRs as required by federal regulations, e.g., FDA reporting requirements. Incorrect approaches analysis. Discontinuing all medications without prescriber consultation is a failure to adhere to collaborative practice agreements and prescriber authority. It risks destabilizing the patient's underlying conditions and is a direct violation of professional responsibility to manage medications in conjunction with the prescribing physician. Ignoring the reported symptoms and attributing them to the patient's underlying condition without further investigation is a failure to recognize and respond to potential ADRs. This neglects the pharmacist's duty to monitor patient response to therapy and can lead to delayed diagnosis and management of serious adverse events, violating patient safety standards and potentially leading to harm. Prescribing an over-the-counter (OC) medication to manage the symptoms without assessing its potential interactions with the patient's current prescription medications is a significant ethical and regulatory breach. This bypasses the prescriber, fails to consider the full pharmacological profile of the patient, and could lead to dangerous drug interactions or masking of the underlying ADR, compromising patient safety. Professional reasoning. Pharmacists should approach such situations by first gathering comprehensive patient information, including current medications, medical history, allergies, and the nature of the adverse event. Next, they should utilize their pharmacological knowledge and available resources to hypothesize potential causes, considering drug-drug interactions, pharmacogenomic factors, and the drug's mechanism of action. The critical step is to then communicate these findings and proposed interventions to the prescriber in a clear and concise manner, advocating for the patient's best interest. This collaborative approach ensures that medication-related problems are addressed effectively and safely, adhering to the principles of patient-centered care and regulatory compliance. Question 8. Upon reviewing a prescription for an antibiotic for a 5-year-old child weighing 20 kg, who has a documented history of moderate renal impairment, the pharmacist notes the prescribed dose is 15 mg/kg every 12 hours. The standard pediatric dose for this antibiotic is 10-20 mg/kg every 12 hours. Which of the following approaches best reflects the pharmacist's professional responsibility in this situation? Option A. Calculate the child's estimated creatinine clearance and adjust the antibiotic dosage based on renal function to ensure therapeutic efficacy and minimize toxicity. Option B. Administer the higher end of the standard pediatric dosing range, 20 mg/kg, to ensure adequate therapeutic levels, given the child's age. Option C. Contact the prescriber to question the appropriateness of the dose solely based on the child's age and weight without mentioning renal impairment. Option D. Dispense the medication as prescribed, assuming the prescriber has already accounted for the child's renal impairment. The correct answer is A. Calculate the child's estimated creatinine clearance and adjust the antibiotic dosage based on renal function to ensure therapeutic efficacy and minimize toxicity. Explanation: this scenario presents a professional challenge because it requires the pharmacist to interpret and apply clinical guidelines and patient-specific data to ensure safe and effective medication therapy, specifically concerning pediatric dosing. The complexity arises from the need to consider multiple factors beyond a simple weight-based calculation, such as renal function, which significantly impacts drug clearance and potential toxicity. Careful judgment is required to avoid under- or overdosing, which can have serious consequences in pediatric patients. The correct approach involves calculating the estimated creatinine clearance to assess renal function, and then using this information to adjust the pediatric dosage of the antibiotic. This aligns with the principles of evidence-based practice and patient safety, as outlined in professional standards and regulatory guidelines for pharmacy practice in the United States. Specifically, the United States Pharmacopoeia USP, General Chapter 791, Pharmacy Operations, and the Food and Drug Administration, FDA Guidelines for Pediatric Drug Development emphasize the importance of considering pharmacokinetic parameters, including renal function, when determining appropriate dosages for children. This approach ensures that the prescribed dose is tailored to the individual patient's ability to eliminate the drug, thereby minimizing the risk of adverse effects and maximizing therapeutic efficacy. An incorrect approach would be to solely rely on the standard weight-based pediatric dosing recommendation without considering the patient's renal impairment. This failure to account for altered pharmacokinetics violates the pharmacist's professional responsibility to ensure medication safety and efficacy. Regulatory frameworks, such as those enforced by the state boards of pharmacy, mandate that pharmacists exercise professional judgment and utilize all available patient information to optimize drug therapy. Administering a dose based on a standard calculation without considering the impact of impaired renal function could lead to drug accumulation and toxicity, a direct contravention of the duty of care. Another incorrect approach would be to administer the dose as prescribed without any further investigation or consultation, assuming the prescriber has accounted for all factors. While prescribers are responsible for ordering medications, pharmacists have a coexisting responsibility to review and verify the appropriateness of prescriptions. Failing to identify a potential issue with a dose in a patient with known renal impairment, especially in a vulnerable pediatric population, represents a breakdown in the medication safety system and a failure to uphold professional standards. This could be seen as a violation of the pharmacist's duty to counsel patients and collaborate with prescribers to ensure optimal patient outcomes. The professional decision-making process for similar situations should involve a systematic review of the prescription, patient profile, and relevant clinical information. This includes 1. Verifying the drug dose, route, and frequency. 2. Assessing patient-specific factors such as age, weight, renal function, hepatic function, and allergies. 3. Consulting reliable drug information resources for dosing guidelines, potential interactions, and contraindications. 4. Calculating appropriate doses, considering any necessary adjustments based on patient factors. 5. Communicating any concerns or recommendations to the prescriber. And 6. Documenting all interventions and decisions. Question 9. Risk assessment procedures indicate that a pediatrician has requested a compounded preparation of an antifungal agent for a 3-year-old child with a localized skin infection. The prescriber has requested the medication be prepared as an oral solution. Considering the principles of pharmaceutics and biopharmaceutics, which of the following approaches best ensures patient safety and therapeutic efficacy for this pediatric patient? Option A. Prepare the antifungal agent as an oral solution as requested by the prescriber, ensuring accurate dosing. Option B. Prepare the antifungal agent as a topical cream or ointment for localized application to the affected skin. Option C. Prepare the antifungal agent as an oral solution and advise the prescriber that systemic absorption is a potential concern. Option D. Prepare the antifungal agent as a flavored oral suspension to improve palatability for the child. The correct answer is B. Prepare the antifungal agent as a topical cream or ointment for localized application to the affected skin. Explanation: this scenario is professionally challenging because it requires the pharmacist to critically evaluate the suitability of a non-sterile compounding preparation for a specific patient population, considering both efficacy and safety within the context of established regulatory standards. The pharmacist must move beyond simply following a recipe and instead apply principles of pharmaceutics, biopharmaceutics, and quality assurance to ensure patient well-being. Careful judgment is required to balance the patient's needs with the inherent risks associated with compounded preparations, particularly when dealing with vulnerable populations. The correct approach involves selecting a dosage form that minimizes the risk of systemic absorption of the active pharmaceutical ingredient, API, while still providing adequate therapeutic benefit. This approach prioritizes patient safety by reducing the potential for adverse drug reactions or toxicity, especially in pediatric patients where physiological systems are still developing. This aligns with the fundamental ethical and regulatory obligation of pharmacists to ensure that medications are safe and effective for the intended patient. Specifically, the United States Pharmacopoeia, USP, General Chapter 795, Pharmaceutical Compounding, Non-Sterile Preparations, emphasizes the importance of selecting appropriate dosage forms and routes of administration to optimize therapeutic outcomes and minimize risks. Choosing a topical formulation for localized effect, as opposed to a systemic route, directly addresses this principle by limiting systemic exposure. An incorrect approach would be to simply prepare the medication in the requested dosage form, without considering the implications of systemic absorption. This fails to meet the pharmacist's professional responsibility to assess the appropriateness of the prescription for the patient, disregards the principles of biopharmaceutics, which dictate how a drug is absorbed, distributed, metabolized, and excreted, and how the dosage form influences these processes. Such an approach could lead to unintended systemic exposure, potentially causing adverse effects, and would be a violation of the pharmacist's duty of care, and potentially violate USP 795 guidelines regarding formulation selection for safety and efficacy. Another incorrect approach would be to prepare the medication in a dosage form that, while potentially effective, carries a higher risk of systemic absorption and subsequent toxicity in a pediatric patient. This demonstrates a lack of understanding of pediatric pharmacokinetics and pharmacodynamics, and a failure to apply risk mitigation strategies. It prioritizes convenience or patient preference over established safety considerations, which is ethically and regulatorily unacceptable. This approach neglects the pharmacist's role as a medication expert and patient advocate, failing to identify and address potential drug-related problems before they occur. The professional decision-making process for similar situations should involve a systematic evaluation of the prescription, considering the patient's age, weight, medical condition, and any known sensitivities. The pharmacist should then assess the available dosage forms and routes of administration, considering the biopharmaceutical properties of the API and the principles of drug delivery. This assessment should be guided by relevant USP general chapters, e.g., 795, 797, FDA regulations, and current scientific literature. If there are concerns about the appropriateness of the prescribed dosage form or route, the pharmacist should consult with the prescriber to discuss alternative formulations or strategies that optimize both efficacy and safety for the individual patient. Question 10. Performance analysis shows a pattern of dispensing errors involving look-alike/sound-alike medications at community pharmacy. During a routine check, a pharmacist notices that a prescription for lisinopril 10 mg was dispensed as losartan 50 mg. The patient has already received one dose of the incorrect medication. What is the most appropriate immediate course of action for the pharmacist? Option A. Immediately contact the patient to advise them to stop taking the incorrect medication, assess for any adverse effects, and then follow the pharmacy's established protocol for reporting medication errors and adverse drug events. Option B. Dispense the correct medication to the patient immediately and inform the prescriber of the error at the end of the day. Option C. Document the error internally but do not report it externally, as the patient has only received one dose. Option D. Advise the patient to continue taking the incorrect medication until their next refill and then switch to the correct prescription. Correct answer is A. Immediately contact the patient to advise them to stop taking the incorrect medication, assess for any adverse effects, and then follow the pharmacy's established protocol for reporting medication errors and adverse drug events. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a potential medication error that has already occurred, impacting patient safety. The pharmacist must act swiftly and ethically to mitigate harm, investigate the root cause, and implement preventative measures, all while adhering to professional standards and regulatory requirements for error reporting and patient care. The pressure to act quickly without compromising thoroughness is a key challenge. Correct approach analysis. The correct approach involves immediately verifying the dispensed medication against the prescription, assessing the patient for any adverse effects, and then initiating the facility's established protocol for reporting medication errors and adverse drug events. This aligns with the pharmacist's ethical duty to patient safety and the regulatory requirement to report such events to facilitate quality improvement and prevent future occurrences. This proactive stance ensures patient well-being and contributes to a culture of safety within the healthcare system. Incorrect approach is analysis. Failing to immediately verify the dispensed medication and assess the patient for adverse effects is a failure to uphold the primary ethical responsibility of patient safety. This delay could lead to continued harm if the incorrect medication is administered or if an adverse event goes unnoticed. It also violates the principle of diligent practice expected of a licensed pharmacist. Dispensing the medication without verifying its accuracy against the prescription, even if the patient is waiting, is a direct violation of dispensing standards and a significant patient safety risk. This bypasses a critical quality control step designed to prevent errors. Reporting the error only to the prescriber without following the facility's internal reporting procedures and the mandated adverse drug event reporting mechanisms fails to contribute to the broader quality improvement efforts and regulatory oversight. This limits the ability to identify systemic issues and implement system-wide solutions. Professional reasoning. Professionals should approach such situations by prioritizing patient safety above all else. This involves a systematic process. First, immediate patient assessment and intervention if necessary. Second, accurate verification of the medication and prescription. Third, thorough documentation of the event. Fourth, adherence to all internal and external reporting requirements. And finally, participation in root cause analysis and quality improvement initiatives to prevent recurrence. This structured approach ensures all critical aspects of patient safety and regulatory compliance are addressed. Question 11. Implementation of a new pharmacotherapy guideline for hypertension requires pharmacists to assess the comparative effectiveness of a novel antihypertensive agent versus standard of care. Which research study design would provide the most robust evidence to support this guideline's recommendations regarding the new agent's efficacy and safety? Option A. Cross-sectional study. Option B. Randomized controlled trial. Option C. Observational cohort study. Option D. Case control study. The correct answer is B. Randomized controlled trial. Explanation. This scenario presents a professional challenge because pharmacists are increasingly expected to critically evaluate and apply evidence from clinical research to patient care. The pharmacist must discern the most appropriate study design to answer a specific clinical question, understanding the inherent strengths and limitations of each. This requires more than just recognizing terminology. It demands an understanding of how different study designs impact the reliability and generalizability of findings, directly influencing patient safety and treatment efficacy. Careful judgment is required to avoid misinterpreting study results, which could lead to suboptimal or even harmful therapeutic decisions. The correct approach involves selecting a randomized controlled trial, RCT, to answer the question about the efficacy of a new medication compared to a placebo. This is because RCTs are considered the gold standard for establishing causality and efficacy. By randomly assigning participants to either the intervention, new medication, or control, placebo group. RCTs minimize selection bias and confounding variables, ensuring that any observed differences in outcomes are most likely attributable to the intervention itself. This design provides the highest level of evidence for determining if a new drug is truly effective and safe. Regulatory frameworks, such as those guiding evidence-based practice in pharmacy, prioritize high-level evidence like RCTs when making treatment recommendations. An incorrect approach would be to select an observational cohort study. While cohort studies can identify associations between exposures and outcomes, they are prone to confounding and bias. For instance, patients receiving the new medication might differ systematically from those receiving placebo in ways not accounted for, leading to a spurious association or masking a true effect. This would fail to provide the robust evidence needed to confidently conclude efficacy, potentially leading to the adoption of an ineffective treatment or the rejection of a beneficial one, violating the principle of providing evidence-based care. Another incorrect approach would be to select a case control study. Case control studies are retrospective and start by identifying individuals with an outcome cases and those without controls, then looking back at exposures. This design is not suitable for establishing efficacy of a new treatment because it is difficult to determine the temporal relationship between treatment and outcome, and recall bias can significantly influence results. It is primarily used for investigating risk factors for rare diseases, not for evaluating the effectiveness of an intervention. Finally, choosing a cross-sectional study would also be an incorrect approach. Cross-sectional studies assess a population at a single point in time, measuring both exposure and outcome simultaneously. This design cannot establish causality or determine the effectiveness of a treatment because it does not allow for the assessment of temporal relationships. It can only describe prevalence or associations at a given moment, which is insufficient for evaluating whether a new medication works. Professional reasoning process for similar situations should involve 1. Clearly defining the clinical question. 2. Identifying the hierarchy of evidence and the study designs best suited to answer that specific question, e.g., efficacy vs. association vs. risk factors. 3. Critically appraising the chosen study design for its strengths and limitations in addressing the question. 4. Considering the implications of the study's findings for patient care, safety, and adherence to evidence-based practice guidelines. Question 12. Which approach would be most appropriate for a pharmacist who receives a prescription for a medication that, based on the patient's known medical history and current medications, appears to be potentially inappropriate or unsafe for the patient? Option A. Dispense the medication as prescribed and counsel the patient on potential side effects. Option B. Dispense the medication and immediately report the prescriber to the State Board of Pharmacy. Option C. Contact the prescribing physician to discuss the concerns and clarify the clinical rationale for the prescription. Option D. Refuse to dispense the medication and advise the patient to seek a second opinion from another physician. The correct answer is A. Dispense the medication as prescribed and counsel the patient on potential side effects. Explanation. This scenario presents a professionally challenging situation because it requires the pharmacist to balance patient autonomy, the pharmacist's professional judgment regarding medication appropriateness, and the legal and ethical obligations to dispense a valid prescription. The pharmacist must consider the potential risks to the patient while also respecting the prescriber's intent and the patient's right to receive their prescribed medication, all within the framework of state and federal pharmacy laws and regulations. The correct approach involves a thorough assessment of the patient's condition, the prescribed medication, and the prescriber's rationale before making a decision. This includes gathering information about the patient's current health status, any relevant medical history, and the reason for the prescription. If the pharmacist has a genuine concern about the appropriateness or safety of the medication for the patient, the most professional and legally sound action is to communicate directly with the prescribing physician. This collaborative discussion allows the pharmacist to voice their concerns, understand the prescriber's clinical reasoning, and collectively determine the best course of action for the patient. This approach upholds the pharmacist's duty of care, aligns with the principles of patient safety, and adheres to regulations that encourage interprofessional communication and collaboration to ensure optimal patient outcomes. It also respects the prescriber's authority while fulfilling the pharmacist's role as a medication expert and patient advocate. An incorrect approach would be to dispense the medication without further inquiry, despite having a significant clinical concern. This failure to exercise professional judgment and investigate potential safety issues could lead to patient harm and would violate the pharmacist's ethical and legal responsibility to ensure the safe and effective use of medications. Another incorrect approach would be to refuse to dispense the medication outright and simply inform the patient that it cannot be filled, without attempting to contact the prescriber. This action undermines patient autonomy and the prescriber-patient relationship. It bypasses the opportunity for collaborative problem-solving and could leave the patient without necessary treatment or create unnecessary barriers to care. This approach fails to meet the professional obligation to communicate and collaborate with the prescriber to resolve potential issues. A third incorrect approach would be to dispense the medication and then immediately report the prescriber to the State Board of Pharmacy without first attempting to resolve the clinical concern through communication. While reporting mechanisms exist for egregious or repeated offenses, this immediate escalation without a prior attempt at resolution is premature and can damage professional relationships unnecessarily. The primary focus should be on ensuring the immediate safety and well-being of the patient through direct communication and problem-solving. The professional decision-making process for similar situations should involve a systematic evaluation. 1. Assess the patient and the prescription for potential safety or efficacy concerns. 2. If concerns exist, gather relevant patient information. 3. Initiate direct communication with the prescriber to discuss concerns and understand their rationale. 4. Collaboratively determine the best course of action, which may involve dispensing, modifying the therapy, or referring the patient for further evaluation. 5. Document all interactions and decisions thoroughly. This process prioritizes patient safety, promotes interprofessional collaboration, and ensures compliance with legal and ethical standards. Question 13. The analysis reveals that a patient with severe pain is currently managed with a full opioid agonist. The prescriber is considering adding a new medication that is known to be a partial agonist at the same opioid receptors to provide additional pain relief. Based on principles of pharmacology and receptor theory, what is the most likely clinical outcome if this partial agonist is added to the patient's current regimen? Option A. The partial agonist will increase the overall opioid effect, leading to greater pain relief. Option B. The partial agonist will provide additive pain relief by acting on different receptor subtypes. Option C. The partial agonist will act as an antagonist, completely blocking the effect of the full agonist. Option D. The partial agonist will have no significant effect on pain relief due to receptor saturation by the full agonist. The correct answer is A. The partial agonist will increase the overall opioid effect, leading to greater pain relief. Explanation. The analysis reveals a common clinical scenario where a pharmacist must interpret and apply pharmacodynamic principles to optimize patient care. This situation is professionally challenging because it requires more than just dispensing a medication. It demands an understanding of how a drug interacts with its target, how that interaction translates into a clinical effect, and how individual patient factors might influence this relationship. The pharmacist must consider the therapeutic goal, potential for adverse effects, and the patient's specific physiological state, all within the framework of safe and effective medication use as mandated by NAPLEX relevant regulations. The correct approach involves recognizing that a partial agonist's efficacy is limited by its intrinsic activity, even at saturating receptor concentrations. Therefore, when a patient is already receiving a full agonist for a condition that requires maximal receptor activation for therapeutic benefit, introducing a partial agonist to the same receptor system would not achieve the desired increase in effect and could, in fact, reduce the efficacy of the full agonist by competing for receptor binding sites. This understanding aligns with the core principles of pharmacology tested on NAPLEX, emphasizing the practical application of receptor theory and dose-response relationships to ensure patient safety and therapeutic success. Regulatory frameworks, such as those governing pharmacy practice in the U.S., require pharmacists to exercise professional judgment in medication selection and management to achieve optimal patient outcomes and prevent harm. An incorrect approach would be to assume that any agonist, regardless of its intrinsic activity, would necessarily increase the overall therapeutic effect when added to a regimen already containing a full agonist. This fails to account for the competitive nature of receptor binding and the concept of intrinsic activity, leading to a potentially ineffective or even detrimental therapeutic intervention. Another incorrect approach would be to disregard the receptor type and focus solely on the drug's presence in the body, ignoring the mechanism of action. This overlooks the fundamental principles of pharmacodynamics and the specific interactions at the molecular level that dictate drug effects. Finally, an incorrect approach would be to recommend the partial agonist without considering the patient's current medication and the potential for antagonism, thereby failing to uphold the pharmacist's responsibility to ensure medication appropriateness and prevent adverse drug interactions. Professional reasoning in such situations requires a systematic evaluation of the drug's pharmacology, the patient's clinical status, and the therapeutic goals. Pharmacists should first identify the drug class and its mechanism of action, specifically noting whether it is a full agonist, partial agonist, or antagonist. They must then consider the receptor system involved and the implications of combining drugs that act on the same receptor. This involves recalling or referencing information about intrinsic activity and competitive binding. The pharmacist's decision-making process should prioritize patient safety and therapeutic efficacy, adhering to professional standards and regulatory requirements that mandate the provision of optimal pharmaceutical care. Question 14. The control framework reveals that a pharmacist receives a written prescription for a Schedule Roman III controlled substance. The prescription includes the patient's name, address, the drug name, strength, dosage form, directions for use, and the date issued. However, the prescriber's signature is missing from the prescription. According to North American Pharmacist Licensure Examination, NAPLEX, jurisdiction regulation, what is the most appropriate course of action for the pharmacist? Option A, contact the prescriber's office to obtain the missing signature. Option B, fill in the prescriber's signature based on previous prescriptions. Option C, refuse to dispense the medication without any attempt to contact the prescriber. Option D, dispense the medication and have the prescriber sign it at a later date. The correct answer is A. Contact the prescriber's office to obtain the missing signature. Explanation: scenario analysis. This scenario presents a professional challenge due to the pharmacist's responsibility to ensure patient safety and adherence to federal and state regulations regarding controlled substances. The pharmacist must balance the patient's immediate need for medication with the legal requirements for prescription verification and the potential for diversion or misuse. The pharmacist's professional judgment is critical in determining the appropriate course of action when faced with an incomplete prescription for a controlled substance. Correct approach analysis. The correct approach involves contacting the prescriber to obtain the missing information. This aligns with federal regulations, specifically the Controlled Substances Act (CSA) and its implementing regulations by the Drug Enforcement Administration (D), which mandate that prescriptions for controlled substances must contain specific information, including the prescriber's signature, patient's full name and address, drug name, strength, dosage form, quantity, directions for use, and the date issued. State pharmacy laws and Board of Pharmacy regulations further define these requirements and the pharmacist's due diligence responsibilities. Ethically, the pharmacist has a duty to protect the patient and the public from potential harm associated with controlled substances, which necessitates verifying the legitimacy and completeness of such prescriptions before dispensing. Incorrect approaches analysis. One incorrect approach is to dispense the medication without the prescriber's signature. This directly violates federal and state laws governing controlled substances, as a prescriber's signature is a mandatory element for a valid prescription. Failure to obtain this can lead to severe legal penalties, including fines and license suspension. Another incorrect approach is to assume the prescriber's intent and fill in the missing information, such as the prescriber's signature, without direct confirmation. This constitutes prescription forgery and is a serious legal and ethical violation. It undermines the integrity of the prescription process and can have dangerous consequences. A third incorrect approach is to refuse to dispense the medication without attempting to contact the prescriber. While caution is warranted, a complete refusal without any effort to resolve the issue may not be in the patient's best interest, especially if the missing information can be easily and legitimately obtained. The pharmacist's role includes facilitating access to necessary medication when legally and safely possible. Professional reasoning. Pharmacists should approach situations involving controlled substance prescriptions with a heightened sense of diligence. The decision-making process should prioritize patient safety and legal compliance. When encountering an incomplete controlled substance prescription, the pharmacist must first identify the missing essential elements required by federal and state law. The primary action should always be to attempt to contact the prescriber or their authorized representative to clarify and obtain the missing information. Documentation of all such communications and actions taken is crucial for legal protection and quality assurance. If the prescriber cannot be reached or refuses to provide the necessary information, the pharmacist must then make a professional judgment about whether dispensing is permissible, often leading to the refusal of the prescription while documenting the reasons. Question 15. The efficiency study reveals that a new extended-release capsule formulation of a cardiovascular medication demonstrates a consistent drug release profile in controlled laboratory settings. When considering the broader clinical application and patient use, which of the following approaches best ensures the continued efficacy and safety of this modified-release dosage form? Option A. Prioritizing the selection of the most cost-effective packaging options to minimize dispensing costs, even if they offer less protection against environmental degradation. Option B. Relying solely on the manufacturer's published data regarding the drug release profile and assuming consistent performance across all patient demographics and environmental conditions. Option C. Focusing primarily on patient self-reported satisfaction with the capsule's ease of swallowing and assuming that positive feedback indicates optimal drug delivery. Option D. Evaluating the potential impact of common environmental factors, such as temperature fluctuations and humidity, on the capsule's integrity and drug release characteristics, and assessing the formulation's biopharmaceutical performance in diverse patient populations with varying gastrointestinal transit times. Correct answer is D. Evaluating the potential impact of common environmental factors, such as temperature fluctuations and humidity, on the capsule's integrity and drug release characteristics, and assessing the formulation's biopharmaceutical performance in diverse patient populations with varying gastrointestinal transit times. Explanation. This scenario presents a professional challenge because it requires the pharmacist to evaluate the practical application of a new drug delivery system in a real-world clinical setting, balancing patient safety, therapeutic efficacy, and regulatory compliance. The pharmacist must move beyond theoretical knowledge of pharmaceutics and biopharmaceutics to assess how the modified-release formulation will perform in diverse patient populations and under varying storage and handling conditions, all while adhering to FDA regulations and USP standards. Careful judgment is required to identify potential issues that might compromise the drug's intended release profile or patient adherence. The correct approach involves a comprehensive evaluation of the modified-release formulation's performance characteristics, considering factors beyond the immediate dosage form. This includes assessing the impact of potential environmental factors on drug release, understanding the biopharmaceutical implications of the formulation's design in different patient physiological states, and ensuring the packaging adequately protects the product's integrity and facilitates correct administration. This approach aligns with the pharmacist's responsibility to ensure the safe and effective use of medications, as mandated by federal laws like the Food, Drug, and Cosmetic Act, and guided by USP general chapters related to dosage forms and drug product quality. It also reflects the professional standard of care to anticipate and mitigate potential risks associated with new drug technologies. An incorrect approach that focuses solely on the manufacturer's claims without independent verification fails to uphold the pharmacist's duty of due diligence. This overlooks the potential for real-world variations in drug performance and patient response, which could lead to subtherapeutic effects or adverse events. It also neglects the pharmacist's role in identifying and reporting potential drug product quality issues to regulatory bodies. Another incorrect approach that prioritizes cost savings over product integrity is ethically and professionally unsound. Compromising on packaging or storage conditions, even if seemingly minor, can significantly impact drug stability and the modified release mechanism, potentially leading to altered pharmacokinetics and patient harm. This violates the fundamental principle of patient safety and adherence to good pharmacy practice. A third incorrect approach that relies solely on patient feedback without objective assessment of the formulation's performance is insufficient. While patient experience is important, it does not replace the need for a pharmacist to critically evaluate the drug's biopharmaceutical behavior and potential for consistent therapeutic outcomes. This approach risks overlooking formulation-related issues that may not be immediately apparent to the patient. The professional reasoning process for similar situations should involve a systematic evaluation of new drug delivery systems. This includes 1. Understanding the scientific principles behind the formulation and its intended drug release mechanism. 2. Reviewing available clinical data and manufacturer specifications, critically assessing their applicability to the patient population. 3. Considering potential environmental and patient-specific factors that could influence drug performance. 4. Evaluating the suitability of the pharmaceutical packaging for maintaining drug stability and facilitating proper administration. 5. Consulting relevant USB standards and FDA guidelines for dosage form quality and performance. 6. Proactively identifying potential risks and developing strategies for mitigation and patient counseling. Question 16. The performance metrics show a recent increase in dispensing errors related to lookalike/sound-alike (LASA) medications within the community pharmacy. During a routine review, a pharmacist identifies a prescription for Celebrex 200 mg that was intended to be Seal XA20 mg. The pharmacist has confirmed with the prescriber that the patient was indeed prescribed Seal XA20 mg and that dispensing Celebrex 200 mg would have posed a significant risk of adverse effects. Which of the following represents the most appropriate course of action for the pharmacist? Option A. Immediately clarify the prescription with the prescriber, prevent the dispensing of the incorrect medication, and report the error through the pharmacy's internal incident reporting system and to the FDA's MedWatch program. Option B. Dispense the prescription as written, but document the potential LASA error in the patient's profile for future reference. Option C. Document the error in the patient's profile and discuss the LASA confusion with the prescriber during their next routine interaction. Option D. Report the potential LASA error to the prescriber and advise them to issue a new prescription, but proceed with dispensing the original prescription if the prescriber does not immediately respond. Correct answer is A. Immediately clarify the prescription with the prescriber, prevent the dispensing of the incorrect medication, and report the error through the pharmacy's internal incident reporting system and to the FDA's MedWatch program. Explanation. This scenario is professionally challenging because it requires the pharmacist to balance immediate patient safety concerns with the need for systematic error reduction and adherence to reporting requirements. The pharmacist must act decisively to prevent harm, while also contributing to the broader quality improvement efforts within the healthcare system. Careful judgment is required to identify the most effective and compliant course of action. The correct approach involves a multifaceted strategy that prioritizes patient safety through immediate intervention and subsequent reporting, aligning with the core ethical and regulatory responsibilities of a pharmacist. This approach involves directly addressing the immediate risk to the patient by clarifying the prescription and preventing the dispensing of a potentially harmful medication. Simultaneously, it necessitates reporting the error through established channels, such as the pharmacy's internal incident reporting system and potentially the FDA's MedWatch program, as mandated by regulations aimed at improving medication safety and identifying trends. This aligns with the pharmacist's duty to protect patient well-being and contribute to public health by facilitating the collection of data on medication errors and adverse events. An incorrect approach that involves simply correcting the prescription without reporting the error fails to address the systemic issues that may have contributed to the error. This omission prevents the healthcare facility from identifying potential weaknesses in its prescribing or dispensing processes, thereby hindering opportunities for improvement and potentially leading to similar errors in the future. It also bypasses regulatory requirements for adverse event reporting, which are crucial for pharmacovigilance. Another incorrect approach, which involves only reporting the error without directly intervening to prevent immediate harm to the patient, is ethically unacceptable. While reporting is important, the primary responsibility of the pharmacist is to safeguard the patient from harm. Delaying intervention to prioritize reporting would put the patient at unnecessary risk. A third incorrect approach, which involves discussing the error with the prescriber but not taking further action or reporting, is also insufficient. While communication with the prescriber is a valuable step, it does not fulfill the pharmacist's obligation to ensure the patient receives the correct medication and to contribute to the broader system of medication error prevention through formal reporting mechanisms. The professional reasoning process for similar situations should involve a rapid assessment of the immediate risk to the patient. If a medication error is identified that could lead to significant harm, the pharmacist's first priority is to prevent that harm. This typically involves clarifying the prescription with the prescriber or withholding dispensing until clarification is obtained. Following the immediate intervention, the pharmacist must then consider the reporting obligations. This involves understanding the facility's internal policies for incident reporting and any external reporting requirements mandated by state or federal regulations. The pharmacist should also consider the potential for the error to be a lookalike/sound-alike (LASA) error or a high-alert medication issue, which may warrant additional preventative measures or enhanced communication. Finally, the pharmacist should reflect on the error to identify potential contributing factors and contribute to strategies for reducing future errors, such as improving medication reconciliation processes or enhancing patient counseling. Question 17. System analysis indicates that a pharmacist is reviewing new research on a novel anticoagulant. The research includes a meta-analysis of several randomized controlled trials, RCT, demonstrating a statistically significant reduction in stroke risk compared to placebo, with a p-value of 0.03 and a 95% confidence interval for the relative risk of stroke that ranges from 0.65 to 0.95. The pharmacist also encounters a recently published large observational cohort study suggesting a similar reduction in stroke risk, but with a higher incidence of gastrointestinal bleeding. Based on this information, which approach best reflects the application of biostatistics and research principles to evidence-based medicine in pharmacy practice? Option A. Prioritize the findings of the randomized controlled trials, as they provide stronger evidence of causality, and the confidence interval supports a clinically meaningful reduction in stroke risk, while noting the need to further investigate the bleeding risk from the observational study. Option B. Conclude that the evidence is insufficient to recommend the novel anticoagulant due to conflicting findings regarding bleeding risk. Option C. Immediately recommend the novel anticoagulant to all patients at risk for stroke, as both studies indicate a reduction in stroke risk. Option D. Disregard the randomized controlled trials due to the potential for bias and focus on the observational study, as it provides real-world data on bleeding complications. The correct answer is A. Prioritize the findings of the randomized controlled trials, as they provide stronger evidence of causality, and the confidence interval supports a clinically meaningful reduction in stroke risk, while noting the need to further investigate the bleeding risk from the observational study. Explanation. Scenario analysis. This scenario presents a common challenge in pharmacy practice, where a pharmacist must critically evaluate research to inform patient care decisions. The core difficulty lies in discerning the strength of evidence and its applicability to an individual patient, especially when faced with conflicting or preliminary findings. Pharmacists are ethically and professionally obligated to base their recommendations on the best available evidence, which requires understanding study designs, statistical validity, and the hierarchy of evidence. Misinterpreting research can lead to suboptimal treatment, patient harm, or inefficient resource allocation. Correct approach analysis. The correct approach involves prioritizing evidence from well-designed randomized controlled trials, RCT, that demonstrate statistically significant and clinically meaningful outcomes. RCT, particularly those with large sample sizes and appropriate blinding, are considered the gold standard for establishing causality due to their ability to minimize bias through randomization and control groups. When evaluating such studies, a pharmacist should look for a low p-value, typically 0.05, indicating statistical significance, and a confidence interval that does not include the null hypothesis, further supporting the observed effect. The clinical significance of the observed effect, considering the magnitude of benefit versus potential harms and the patient's individual characteristics, is paramount. This approach aligns with the principles of evidence-based medicine, which emphasizes the integration of best research evidence with clinical expertise and patient values. Regulatory frameworks and professional guidelines for pharmacists consistently advocate for the use of high-quality evidence to guide therapeutic decisions. Incorrect approaches analysis. Relying solely on anecdotal evidence or case reports is an incorrect approach. While these can generate hypotheses, they are prone to significant bias and cannot establish causality. Anecdotal evidence represents individual experiences, which may not be generalizable, and case reports, though more structured, lack control groups, and are susceptible to confounding factors. This failure to adhere to the hierarchy of evidence violates the principles of evidence-based practice and can lead to recommendations based on unreliable information. Giving undue weight to observational studies without considering their inherent limitations is also incorrect. Observational studies, such as cohort or case control studies, can identify associations, but cannot definitively prove causation due to potential confounding variables and lack of randomization. While valuable for hypothesis generation and understanding risk factors, they are generally considered lower on the evidence hierarchy than RCTs for establishing treatment efficacy. Basing a definitive treatment recommendation solely on an observational study, especially if it contradicts findings from RCTs, is professionally unsound. Dismissing research based on a single statistically significant finding without considering the confidence interval or clinical significance is another incorrect approach. A statistically significant result, low p-value, does not automatically equate to clinical importance. The magnitude of the effect, as indicated by the confidence interval and the actual difference in outcomes, must be evaluated to determine if the observed benefit is meaningful for patient care. Ignoring this aspect can lead to the adoption of interventions with negligible or even harmful effects. Professional reasoning. Professionals should employ a systematic approach to evaluating medical literature. This involves first identifying the research question and then assessing the study design's appropriateness for answering that question. Next, the internal validity of the study should be examined, focusing on the methodology, statistical analysis, and potential biases. The external validity, or generalizability of the findings to the patient population, must also be considered. Finally, the clinical significance of the results should be weighed against potential harms, costs, and patient preferences, integrating this evidence with clinical expertise and the patient's unique circumstances. This structured approach ensures that decisions are evidence-based, ethical, and patient-centered. Question 18. Consider a scenario where a 65-year-old male patient weighing 70 kg is admitted to the hospital with a severe bacterial infection and is prescribed intravenous vancomycin 1 gram every 12 hours. His most recent serum creatinine level is 1.8 mg/dl. The pharmacist is reviewing the medication order and the patient's laboratory results. Which of the following actions best reflects the pharmacist's professional responsibility in this situation? Option A. Hold the vancomycin dose until a new serum creatinine level can be obtained without further assessment. Option B. Administer the vancomycin as prescribed, assuming the physician has accounted for the patient's renal function. Option C. Contact the physician to question the vancomycin dose, stating that the serum creatinine level is within the normal range. Option D. Calculate the patient's creatinine clearance and adjust the vancomycin dose based on the calculated clearance to ensure therapeutic efficacy and minimize nephrotoxicity. The correct answer is D. Calculate the patient's creatinine clearance and adjust the vancomycin dose based on the calculated clearance to ensure therapeutic efficacy and minimize nephrotoxicity. Explanation. This scenario presents a professional challenge because it requires the pharmacist to interpret and apply laboratory values in the context of a patient's medication regimen, specifically focusing on the safe and effective administration of a potentially nephrotoxic drug. The pharmacist must not only understand the relationship between creatinine clearance and drug dosing, but also recognize the implications of abnormal laboratory findings for patient safety and therapeutic outcomes. Careful judgment is required to ensure the patient receives an appropriate and safe dose, preventing potential adverse drug events. The correct approach involves calculating the patient's creatinine clearance using the provided laboratory value and the patient's weight, and then adjusting the dosage of vancomycin based on this calculated clearance. This aligns with established clinical practice guidelines and regulatory expectations for pharmacists to ensure appropriate drug therapy. Specifically, the United States Pharmacopoeia USP, General Chapter 797 and 800, address sterile compounding and hazardous drug handling, which indirectly relate to ensuring appropriate dosing for drugs like vancomycin, especially when administered intravenously. Furthermore, the Accreditation Council for Pharmacy Education, ECPE, standards emphasize the pharmacist's role in patient care, including medication therapy management and the interpretation of clinical data to optimize drug therapy. This approach prioritizes patient safety by ensuring the vancomycin dose is tailored to the patient's renal function, minimizing the risk of nephrotoxicity and subtherapeutic levels. An incorrect approach of administering the standard adult dose without considering the patient's renal function represents a significant regulatory and ethical failure. This disregards the pharmacist's responsibility to individualize drug therapy based on patient-specific factors, potentially leading to serious adverse events such as acute kidney injury. This failure violates the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Another incorrect approach of relying solely on the physician's initial order without independent pharmacist review also constitutes a failure. While physicians initiate therapy, pharmacists have a professional and legal obligation to review and verify medication orders for appropriateness, including dose adjustments based on clinical parameters. This oversight could lead to medication errors and harm, violating the pharmacist's duty of care. A third incorrect approach of assuming the laboratory value is erroneous without further investigation is also professionally unacceptable. While errors can occur, a pharmacist's role is to critically evaluate all available information. If a laboratory value appears inconsistent with the patient's clinical presentation or expected drug response, the pharmacist should investigate further by consulting with the prescriber or rechecking the value, rather than making an assumption that could compromise patient care. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's clinical status, including all available laboratory data. Pharmacists should utilize evidence-based guidelines and drug information resources to interpret laboratory values and their impact on drug therapy. They must then apply this knowledge to adjust dosages or recommend alternative therapies as appropriate, always prioritizing patient safety and therapeutic efficacy. This process necessitates critical thinking, clinical judgment, and effective communication with the healthcare team. Question 19. Governance review demonstrates a need to enhance the pharmacist's role in personalized medicine. A patient with a history of cardiovascular disease is being considered for clopidogrel therapy. Pre-treatment genetic testing reveals the patient is a CYP2C19 poor metabolizer. The pharmacist's primary responsibility in this situation is to: Option A. Proceed with dispensing clopidogrel as prescribed, as genetic testing is not a mandatory component of clopidogrel therapy. Option B. Recommend to the prescribing physician that an alternative antiplatelet agent be considered due to the patient's CYP2C19 poor metabolizer status, as this may lead to reduced efficacy of clopidogrel. Option C. Advise the patient that clopidogrel will be ineffective and they should not take it. Option D. Initiate genetic testing for other CYP enzymes to determine if other drug interactions are likely. The correct answer is B. Recommend to the prescribing physician that an alternative antiplatelet agent be considered due to the patient's CYP2C19 poor metabolizer status, as this may lead to reduced efficacy of clopidogrel. Explanation. This scenario presents a professional challenge due to the inherent complexity of pharmacogenomics and its application in individualizing therapy. The pharmacist must navigate the ethical and regulatory landscape surrounding the use of genetic information to guide drug selection and dosing, ensuring patient safety and efficacy while adhering to professional standards and potential state board of pharmacy regulations regarding genetic testing and interpretation. The challenge lies in translating complex genetic data into actionable clinical decisions within the scope of pharmacy practice. The correct approach involves a comprehensive assessment of the patient's genetic profile in conjunction with their clinical presentation, current medications, and relevant drug information resources. This approach prioritizes patient safety and optimal therapeutic outcomes by leveraging pharmacogenomic data to predict drug response and minimize adverse events. Regulatory justification stems from the pharmacist's responsibility to provide evidence-based, patient-centered care, which includes utilizing all available tools to enhance medication therapy management. Ethical considerations mandate informed consent and the responsible use of sensitive genetic information. An incorrect approach that relies solely on a single genetic marker without considering the broader clinical context is professionally unacceptable. This fails to acknowledge the multifactorial nature of drug response and can lead to inappropriate therapeutic decisions, potentially causing harm. It also overlooks the importance of integrating genetic information with other patient-specific factors, a core principle of individualized therapy. Another incorrect approach that involves making definitive therapeutic changes based solely on genetic predisposition, without corroborating clinical evidence or consulting with the prescribing physician, is a violation of professional boundaries and patient safety protocols. Pharmacists are integral members of the healthcare team, and significant medication adjustments require collaborative decision-making. This approach bypasses necessary clinical validation and can lead to unintended consequences. Finally, an incorrect approach that involves recommending genetic testing without a clear clinical indication, or without ensuring proper patient counseling regarding the implications of the test results, is ethically problematic and potentially violates regulations governing laboratory testing and patient rights. Pharmacists must ensure that any diagnostic or predictive testing is medically appropriate and that patients fully understand the purpose, limitations, and potential outcomes of such testing. The professional decision-making process should involve a systematic evaluation of the patient's genetic information, clinical status, and therapeutic goals. This includes consulting reputable pharmacogenomic databases, collaborating with prescribers, and engaging in thorough patient counseling to ensure informed decision-making and safe medication management. Question 20. Stakeholder feedback indicates that some patients are requesting over-the-counter (OTC) medications for conditions that may require prescription intervention or have significant underlying risks. A patient presents to the pharmacy requesting a specific high-strength topical corticosteroid for a widespread rash that has been present for several weeks. The patient states they have used this product before for a similar rash, and it worked well. The pharmacist notes the rash appears to be spreading and has some signs of secondary infection. Which of the following represents the most appropriate course of action for the pharmacist? Option A. Engage the patient in a discussion about their rash, assess their symptoms, explain the potential risks of using a high-potency corticosteroid without a current prescription and diagnosis, and recommend appropriate OTC alternatives or referral to a physician if the condition appears to warrant it. Option B. Dispense the requested high-strength topical corticosteroid as requested by the patient, assuming they have prior experience and knowledge of its efficacy for their condition. Option C. Refuse to dispense the medication and advise the patient to see a physician for diagnosis and treatment, without offering any further assistance or information. Option D. Dispense a lower potency OTC topical corticosteroid and advise the patient to use it for a few days, without further discussion or assessment of the current rash. The correct answer is B. Dispense the requested high-strength topical corticosteroid as requested by the patient, assuming they have prior experience and knowledge of its efficacy for their condition. Explanation. This scenario presents a professional challenge due to the conflict between a patient's expressed wishes and the pharmacist's professional judgment regarding the appropriateness of a requested medication for their condition. The pharmacist must navigate patient autonomy, the principle of beneficence, acting in the patient's best interest, and the legal and ethical obligations to dispense safely and appropriately. The core of the dilemma lies in determining when a pharmacist's professional responsibility to prevent harm outweighs a patient's right to self-determination, particularly when the patient may not fully understand the risks or when the requested medication is not indicated. The correct approach involves a thorough patient assessment and open communication. This includes understanding the patient's rationale for requesting the medication, assessing their understanding of their condition and the proposed treatment, and educating them on the risks and benefits of the requested medication versus alternative, evidence-based therapies. If, after this comprehensive discussion, the pharmacist determines the requested medication is inappropriate or potentially harmful, they have a professional and ethical obligation to refuse to dispense it and to offer appropriate alternatives or referral. This aligns with the pharmacist's role as a medication expert and gatekeeper of safe and effective drug therapy, as outlined by pharmacy practice standards and ethical codes that prioritize patient well-being and public safety. The pharmacist's duty is to ensure that medications are used appropriately and to prevent harm, which may necessitate refusing a prescription if it is deemed unsafe or ineffective. An incorrect approach would be to dispense the medication solely based on the patient's request, without further assessment or discussion. This fails to uphold the pharmacist's professional responsibility to ensure appropriate medication use and could lead to patient harm, violating the principle of beneficence. Another incorrect approach would be to dismiss the patient's concerns or request outright without engaging in a dialogue. This disrespects patient autonomy and can damage the patient-pharmacist relationship, hindering future therapeutic interventions. Finally, dispensing the medication while harboring significant doubts about its appropriateness without documenting the concerns or seeking further clarification would be a failure to act with due diligence and could have serious legal and ethical repercussions. The professional decision-making process for similar situations should involve a structured approach. 1. Identify the ethical and professional conflict. 2. Gather all relevant information about the patient, their condition, and their request. 3. Assess the risks and benefits of the requested action versus alternative actions. 4. Engage in open and empathetic communication with the patient. 5. Consult with other healthcare professionals if necessary. 6. Make a decision based on professional judgment, ethical principles, and regulatory requirements. 7. Document the decision-making process and the rationale.